We are joined by Doctors Carol Drabick and John Michael Johnson from Bishop Eye Associates, and we're going to be talking about advancement in contact lens technology today. So, Dr. Drabick, what are the benefits of contact lens wear versus glasses?
Well, Carrie, there's, of course, the obvious, the aesthetic value of not having the glasses on your face. And then there's a practicality to it. Glasses are an appliance that hang on your nose and ears, and they're fragile. So there are certainly many activities that are not conducive to having an apparatus like that bouncing around on your face. So freedom from glasses. And then there's the visual component. Glasses have a tendency to distort vision to a degree, and the stronger your prescription, the more distortion and aberration you're apt to incur as a process of the space between the eye and the lens. And also, as you look off-center through that lens, more distortion has occurred. You don't get corrected peripheral vision when you wear glasses, so your peripheral vision will be blurry. When you take a contact lens and put that same prescription on the surface of the eye, all of those things go away. So you get a truer, more natural vision, you get corrected peripheral vision, you get enhanced depth perception. So if you're someone that's involved in a sporting activity, your performance is likely to improve, your depth perception and binocularity. So there are those aspects as well.
Dr. Johnson, are there certain folks who are better candidates for contact lenses than others?
Definitely, I think that's the case. I would venture to say now that we can almost get anyone into a contact lens, but really if someone is motivated to really get out of glasses, if someone doesn't like glasses, or even if they have a particular time that they don't want to wear glasses. So it doesn't have to be one or the other. It's not like you have to wear contact lenses all the time or glasses all the time. We have probably more than 50% of our contact lens patients are just part-time wear. They wear them for golf or for tennis or just even going out on the weekend and not having to wear glasses. Probably the other 50% are like me, like they don't want to wear glasses and they would love to wear contacts all the time. So motivation, is a really big key factor, and you do have to learn how to put the lenses in, and you have to learn how to take care of them. But really, if you have that motivation, we can really get you into a lens. I used to worry about patients that have dry eye. My practice and Dr. Drabick's practice in general, we have a lot of dry eye patients that we treat. And we used to almost feel like we would steer them away from contact lens wear. But in the past probably 5 or 10 years, almost all of the contact lens companies have tried to remedy that situation by making lenses that are better for people with dry eye. So now even that, even if you have moderate, severe dry eye, we sometimes will, try contact lenses in a patient that really wants to try them.
Dr. Drabick, have there been developments in the world of contact lenses?
Yes, there have been. Since 2010, the material silicone has been added to contact lenses, and silicone is a much more breathable product, so that allows the exchange of carbon dioxide and oxygen through the lens into the eye, which makes the lens healthier, better tolerated, and more comfortable. So that's one major change that has occurred. Also, as a product of the population that started wearing contact lenses in the 70s and 80s when
My mom had those glass ones.
Yes, mainstream. There have been many innovations along through the years, but most recently the contact lens manufacturers have been driven to try and keep those people that had worn contact lenses through their 20s and 30s and 40s into contact lenses now as they age. And one of the two main reasons for people dropping out of contact lens wear was dry eye, as Dr. Johnson mentioned. Mm-hmm. And so they've come out with new innovations to help keep the surface of the lens moist and wettable. They have materials now that bind water to the lens surface, so the lens is floating on the eye and on a surface of moisture. So those patients that had to stop because of dry eye now can continue to wear them. And the second most common reason for dropping out of contact lens wear was the need to now start wearing reading glasses. So for those patients that were motivated to wear contacts to eliminate glasses, they were now having to reach for reading glasses all the time, and that
Right.
became such a nuisance. It just made more sense to say, well, forget it. I'll just put on glasses, wear them all the time, and forget the contact lenses.
Yeah.
So because of that, and because of the demand for a solution to that, they have now innovated and improved lenses that were available for treating both distance and near vision. A multifocal lens, they didn't work very well, and they've now come up with some products that work very well. So those patients that might have been unsuccessful trying to wear a multifocal contact lens in the past, we can get a large majority of them back comfortably into contact lenses and seeing well.
That's fantastic. I think it sort of touches on what Dr. Johnson was saying about the motivation of it. If somebody's really motivated to get in contact lenses but couldn't prior, they should definitely come see now with all the new
Sure.
developments.
Sure. And now the two main types of contact lenses still exist, the soft and the hard. The hard are now gas permeable. They also have silicone added to them, and that's what makes them gas permeable, but they still fit and feel like a hard lens. And they've innovated those also to be better wettable, more comfortable, multifocal options. And then we have options of lenses to correct astigmatism. A lot of people were told they couldn't wear
Yes.
contacts because they had astigmatism. We have soft lenses that do a wonderful job of correcting for astigmatism, so rarely does that limit us. And then there's a smaller group of people that have an extreme amount of astigmatism or irregular astigmatism, and there are lenses now that deal with that are a hybrid. They have a rigid gas permeable center to correct for the irregular cornea and a soft surrounding skirt to give the comfort of a soft lens.
Wow.
So for those patients that couldn't tolerate a rigid lens can now have the benefits and the vision correction of a rigid lens with the comfort of a soft. So there's very few people, if they're motivated enough, that
Can't get into
yeah,
contact
into
lenses. I've seen those advertisements for folks who can sleep in their contact lenses. Is that safe, and is there like a certain, how long can somebody be in a contact lens before needing to change it out?
You know, as far as that's concerned, it's kind of a reason why I almost chimed in, because it's a little of a soapbox thing with me. The FDA has approved some lenses, probably about 3 or 4 different lenses that are 30-day continuous wear. So what that means is basically you could put the lens in on June 1st and take it out June 30th, do nothing else, sleep in it, go the whole time with it. And at first, you know, I was really excited about these lenses, as all, you know, probably eye doctors were, because it really would meet, you know, the requirements of some patients that really want to have the minimum, you know, sort of interaction with lenses. What we found, though, over the years, and has actually been supported by clinical studies, is really you get more complications with those lenses. You know, I should say you get more complications if you sleep in them in the way that they're approved to sleep in. You know, for 30 days straight is just a little bit much on your eye for most people. As far as, you know, what problems do they cause? More allergies, more foreign body sensation, things like that. The nice thing is really the reason why they're approved is because they're a lot healthier for your eyes. They have more oxygen permeability than any lens that's ever been out there, and really the initial studies for the FDA have shown that they're not going to cause harm. My problem with them is just that sometimes they cause more irritation, which the patient's not as happy with.
Sure.
So what I'd usually rather them do is, if they really need to sleep in it, to, you know, take it out at least once a week, give their eyes a break. New patients, I really don't like try to push them into that lens, just because you know, I'm worried that they will have maybe a little more irritation. But really, I do have quite a few patients that do it, and they've been doing it for, you know, for years, that came to me in it and are successful. And probably the majority of patients can be successful in it. I just tend to, if there's not going to be a problem, if there's not a problem already, I don't want to cause a problem.
Sure.
One of the big things that, instead of that lens, I really like a daily lens, which is just as convenient in some ways, because you don't have to clean it, you don't have to store it. You basically throw it away every day. You know, they come in 90 packs. And if we took the complication rate of both of those lenses, there's almost no complications with a daily lens because you're throwing away bacteria, you're throwing away any sort of, protein buildup. I mean, what do you think about daily lenses versus monthly?
It's far and away my first preference. It's more comfortable. You're putting in a fresh, clean, sterile lens every day. So most of the issues that we used to see with contact lens wear was related to the age and condition of the lens. So if you eliminate those, and solution reactions. So if you eliminate those three variables, which you are with a daily disposable, then you eliminate 99% of the problems that we used to see with lens wear.
Now, is there a cost difference?
There is a cost differential, and I won't say it equalizes out, but you do eliminate the need for solutions, so you save on the cost of solutions. And most people can be fit with a lens, and there are various lenses depending on whether you want a multifocal. They do have multifocal disposables. We have astigmatic disposables, and we have the regular spherical disposables for people that just need distance vision or a basic prescription. And in any of those designs, for the majority of people, you could fit them in under $2 a day, sometimes less than $1.50 a day.
Wow.
With a disposable lens.
So that's cost effective.
Yes, the convenience and the benefits in both health, vision, and comfort make it definitely my first choice.
Okay.
And really a comparison of like a true 30-day lens that you can sleep in versus a daily disposable, the cost difference is really negligible, because the lenses that you have every day, basically, every day you're throwing away a lens. Usually throughout a year, someone will actually lose a lens or tear a lens. If you have a monthly lens that is a $15 lens versus a small daily lens, which is a 75 cents, lens, it actually ends up equaling out over the year.
Sure. Now, Dr. Johnson, are there any other benefits to contact lenses besides the aesthetics of glasses?
Definitely. Hopefully most of your viewers won't have to, be involved in most of those, because some of them are for, ocular disease. And quite often we use contact lenses. We use soft bandage contact lenses to help heal injuries, or after surgery. Sometimes we will use soft bandage contact lenses to infuse medication into the lens and let it sort of sit on the eye and help to heal, just like a bandage would. I also do a large diameter, what's called a scleral lens. It's almost like maybe kind of what your mom used to have. It's more of a hard, rigid gas permeable lens that you can actually fill with fluid. And when you put on your eye, it keeps your eye in almost like a fishbowl of artificial tears all day. That's great for patients with severe dry eye or corneal disease. Not only will it help them see better, but it actually helps the cornea heal. There's a condition called keratoconus, where throughout your lifetime you have more and more astigmatism progressively kind of getting worse and irregular. And for these patients, they can't see with glasses. They really can't see with contact lenses in general unless we use a specialized rigid gas permeable lens, which will basically not only sometimes help slow the progression of that process, but it will actually help you to see quite a bit better. So really, it's not just for, like we said earlier, aesthetics. We have a lot of medical conditions that we treat with contact lens wear. Yeah.
So if someone were to come and get an evaluation, can you tell us, Dr. Drabek, what they would expect?
Sure. They, of course, if it's been a year, they would need a comprehensive eye exam just to rule out any medical issues, both with the eye.
Yeah, that annual eye exam, very, very important.
With the eye and also looking for systemic disease. And once that has been done, then we use the measurements that we take to determine glasses prescription. And from those measurements, we can determine the best trial lens. And we have a whole array of different trial lenses in the office. So we would try on the lens that meets the goals and needs of the patient. We interview them to determine what their visual needs are. Do they spend a lot of time on the computer? Do they need really clear close vision? Is their issue more distance vision? Do they want the versatility of both? To determine what design is best, as well as do they have astigmatism, dry eye, and whatnot. And then when we determine that best trial lens, we put that on. We might take some measurements and adjust and pick out something different. And in most cases, they can go home with, especially in the case of the daily disposables, they'll go home with a 5-pack of lenses to wear over the next 5 days to try. We have them, before they leave, sit down with one of our well-trained technicians who teaches them how to put them in, how to take them out, care, handling, troubleshooting tips so they don't go home and feel overwhelmed by that.
Yeah.
And then they come back in a week. Usually we recommend they wear the lens in so we can measure the lens, check the fit, and make any adjustments that we need to. And at that time we can issue a contact lens prescription, and usually they're off and running for a year unless they have issues.
Fantastic. So that's like you cover the whole thing for them, the whole
Yes.
gamut.
Yeah.
Perfect. So Bishop Eye Associates, these are the folks that you definitely want to check out for your contact lens needs and also for those annual eye exams. Thanks for watching Better Health, Better Life. This is a show where we connect you with the best local healthcare providers and help you make informed decisions and stay fabulous, Sun City.